I'm Sandra A. Wright with Greater Cincinnati African American Heart Association. I am the founder and president of the organization. In 2014, I had a virus that ended up affecting my heart. And so, what I learned through that process is when you get a virus, it will typically affect the weakest organ in your body. I learned somewhere in my early 30s that I had an irregular heartbeat, but I never thought anything about that. I just thought it was normal for me. When I got that virus, it attacked my heart, and that was the beginning of heart failure for me. I had no prior episodes with my heart, but the symptoms that I had after the virus was shortness of breath. That was the first signal that something was wrong. And so after a few occurrences of noticing how severe my shortness of breath had become, that's what sent me to the hospital initially. So through that process is when I learned that I had congestive heart failure due to the virus attacking my heart. That happened in 2014, so in 2017, I had to have a heart transplant. And that landed me in the hospital for about a 50-day total through that whole process. The recovery was miraculous. I mean, if you're looking at me, and so if you didn't know, you wouldn't know. I left the hospital when they discharged me and went shopping. And so I've been going ever since because God is real and He kept me through my process. But in terms of looking for an organization such as the Greater Cincinnati African American Heart Association, or even the Closing the Health Gap, because at the time of my process, I didn't even think to know that there was Closing the Health Gap. And so it was a lonely process in regard to that, because the places that I did end up connecting with, the way the information was presented, it definitely was not something that was relatable to the way I'm cultured. My life has changed immensely. Now I am a community health advocate, and I am everywhere speaking and talking about the severity of heart condition, especially in the African American community, and why it is so very important for us to understand our numbers, what they mean, understand what to do with the comorbidities, which are the illnesses that we face, like diabetes, obesity, high blood pressure. All of that leads to a path, can lead you to a path of heart failure. Okay, prevention. As I just touched on, know your numbers. Know what those numbers mean when you get your labs. Don't just look at something and dismiss it. That's one thing. Also, your diet. That's the main thing. What you are, what you eat. What you put in your body is what's going to manifest outwardly. And so a lot of sickness and disease comes from having a poor diet and just poor health care issues, period. If you're not getting adequate sleep, if you are living a high stress life, and you've got a lot of toxic people in your life, my advice to that is start eliminating some of those toxins that you can get rid of. And sometimes that means getting rid of some toxic people. Because stress is real, and it does manifest into serious sickness if you don't deal with it. Certainly, I am very delighted to be connected with the Closing the Health Gap in terms of having this opportunity to be here to speak. And I would encourage people to also visit our website, the Greater Cincinnati African American Heart Association, also known as GCAAHA, and you can find us at www.gcaaha.org. Go out and visit us and see if there's something there that might help you as well. Thank you for this opportunity.